There's a quiet threat that robs many people of their independence after the age of 60. And most of the time, it isn't just knee discomfort. It's that moment when you start hesitating before rising from a chair, when you begin avoiding staircases, when you shift your weight cautiously, and when you slowly stop trusting your own leg. Because once your knee starts dictating your movements, your daily routine begins to shrink, and that directly threatens your independence. Today, Dr. Thomas will help you learn one simple, safe, and genuinely practical exercise for knee pain after 60, including easy, low-impact variations commonly used in physical therapy. But because Dr. Thomas understands that many people dealing with pain can't jump straight into the main movement, he'll first walk you through 4 step-by-step preparatory exercises designed to build strength in your leg and knee, so you can approach the main exercise more safely and with significantly less discomfort. And here's something most people don't hear often enough. In many cases, the problem isn't simply age. What typically occurs is a combination of factors working against you at once. The thigh loses strength, the glutes become weaker, the ankle and hip grow stiffer, and layered on top of all that comes the fear of pain itself. People move less, alter the way they walk, tighten up to guard themselves, and the knee ultimately absorbs even more strain as a result. How the knee actually works. Let Dr. Thomas explain this the same way he does with patients in the clinic. The knee is supported by muscles. It functions like a hinge position between the hip and the ankle. When the thigh, particularly the quadriceps, loses strength, the knee loses control during everyday actions like sitting down, standing up, and climbing steps. The joint then absorbs more load than it's designed to handle, and in the wrong way, which makes pain appear far more easily. This is precisely why, even when osteoarthritis is present, current clinical guidelines continue to place therapeutic exercise and progressive strengthening at the core of treatment. The glutes, meanwhile, act like the knee's personal bodyguards. When you place weight on a single leg, the hip muscles work to keep the entire limb properly aligned. When those muscles are weak, the leg tends to drift inward, placing a more damaging type of load on the knee. In practical terms, that means more pain and less confidence with every step. That's why, in over 10 years as a physical therapist, Dr. Thomas almost never focuses exclusively on the knee. Dr. Thomas works the entire leg, especially the hip and thigh, so that the knee stops absorbing all the consequences on its own. Today, Dr. Thomas will guide you in a simple, safe format. No gym equipment, no impact, and with chair or wall support available whenever you need it. Dr. Thomas will move you through 4 preparatory exercises to activate the thigh and glutes and to improve overall leg control. At the end, Dr. Thomas will introduce the main exercise, the most important one in this entire video, because it trains a movement you perform in real life multiple times every single day. And let's establish one ground rule right now. Mild muscle fatigue can occur. Sharp knee pain should not. Here, we are focused on safety, control, and consistency. One important note, this content is educational and does not replace professional medical care or an individual assessment with a physical therapist. If your pain is intense, persistent, or accompanied by swelling or locking, the right step is to consult a qualified professional like Dr. Thomas. Exercise 1. Steady leg. Dr. Thomas likes beginning with this exercise because it's straightforward, safe, and it already activates one of the most important muscle groups the knee depends on for stability, the front of the thigh. It wakes up the leg without any impact and without requiring a large range of motion right away. To perform it, sit on a sturdy chair with your feet flat on the floor and your torso upright but relaxed. Choose one leg to begin. Slowly straighten the knee, lifting your foot as far as feels comfortable, without forcefully locking the joint at the top. Straighten, hold briefly, then lower the leg back down very slowly and with full control. The real key here is the tempo. This is not a kicking motion where you let the leg drop. You lift with intention and lower even more slowly, as though you're deliberately breaking the movement. That approach increases muscular engagement and teaches the knee to move in a more controlled, protected way. At the end of each set, perform an isometric hold. Keep the leg fully extended for several seconds. If you're just beginning, hold for 10 to 15 seconds. If that feels manageable, progress to 20 seconds. Over time, as you grow stronger, you can work toward a 30-second hold. This sustained position builds significant thigh strength without any impact whatsoever. 2 mistakes to watch for: moving too quickly, almost like a kick, and leaning your torso backward to assist the leg in lifting. If either happens, reduce how high you raise the leg and focus on keeping your upper body stable. If the exercise feels difficult, shorten the range and hold for less time at the end. If it feels easy, add a 1-second pause at the top of each repetition and extend the final isometric hold slightly. Dr. Thomas recommends beginning with 8 to 10 repetitions on one side, up to 15 if it feels comfortable, then switch legs. Perform the isometric hold at the end of each side. 1 to 2 sets is appropriate to start. Exercise 2. Knee shield. This is one of the most valuable exercises Dr. Thomas recommends for protecting the knee in daily life, even though most people wouldn't expect it, because it doesn't target the knee directly. Dr. Thomas calls it the knee shield because it strengthens the outer hip and helps prevent the inward collapse of the knee that increases joint overload and discomfort. Consider how often this pattern appears in real life: stepping onto a stair, walking at a faster pace, or rising from a chair and moving into your stride. When the hip isn't stable, the leg loses alignment and the knee begins to compensate. That's why Dr. Thomas places so much value on this exercise. It doesn't work on the knee itself, but it significantly reduces the demands placed on it. To perform it, stand behind or beside a sturdy chair, holding it with one hand for support. Support is not a sign of weakness, it's a sign of good judgment. Keep your torso upright, your gaze forward, and your feet aligned beneath you. Without allowing your body to tilt sideways, slowly move one leg out to the side, away from your midline. It's a short, controlled motion. You don't need to lift high. What matters is feeling the outer hip engage. Slowly return and repeat. The essential technical point: do not let your torso sway to the side. Many people lean their body to assist the leg in lifting. When that happens, the hip works far less, and the exercise loses its intended effect. Think of it this way: your body stays completely still and only the leg moves. One additional detail: keep your toes pointing forward throughout. Rotating the foot outward shifts the focus away from the target muscles. If the movement feels challenging, reduce the range and hold the chair with both hands. If it feels easy, a resistance band placed above the knees or around the ankles can add appropriate progression, but only if the movement remains fully controlled and pain-free. Dr. Thomas suggests beginning with 8 to 12 repetitions on one side, then switch. Start with 1 set and build toward 3 sets as your comfort and strength improve. The priority is control, alignment, and feeling the hip doing the actual work. Exercise 3. Heel back. While the previous exercise targeted the outer hip, this one activates the back of the hip, primarily the glute. This matters because when the glutes are underdeveloped, the body compensates in ways that go unnoticed at first. People feel less stable on their feet, lose steadiness while walking, and the knee ends up absorbing more load than it should. To perform it, stand with support from a sturdy chair, using one or both hands. Keep your torso upright, shoulders relaxed, and feet aligned beneath you. Now slowly take one leg back, as though you're pressing your heel directly behind you. The range of motion is small. You don't need to swing the leg far. The goal is simply to feel the glute activating. Here is the most critical technical detail that Dr. Thomas always emphasizes. Do not arch your lower back. This is the most frequent mistake. When people extend the leg behind them, they often push the abdomen forward and curve the spine. At that point, the lower back takes over the movement instead of the glute. The correction is straightforward. Keep your core gently engaged, your torso stable, and keep the movement small and deliberate. A secondary mistake is bending the moving knee too sharply, as though kicking backward. If this happens, reduce the range and focus on extending the leg back in a lengthening motion rather than a bending one. A slight bend is acceptable, but the attention should remain on the hip. If the exercise feels difficult, use both hands for support and reduce the range of motion. If it feels easy, a resistance band at the ankles or above the knees can provide added challenge, provided your torso stays steady and the lower back remains neutral. Dr. Thomas recommends beginning with 8 to 12 repetitions on each side and performing 1 to 2 sets at a pace that feels right for you. The purpose is not to push through discomfort. It's to activate the correct muscles so the knee stops compensating on its own. Exercise 4. Wall Squat Mini. With the fourth exercise, Dr. Thomas moves into territory that bridges the activation work done so far with the main exercise coming at the end. This movement trains strength, control, and physical confidence in the legs, without requiring a deep squat or any high-demand positioning. To perform it, stand facing a wall, roughly 1 step away. Place both hands against it at chest height, with your arms slightly bent. Position your feet hip-width apart. Now perform a mini squat. Bend your knees gently and send your hips backward, as though you're beginning to lower into a chair, but only slightly. Keep the range short and comfortable. Slowly return to standing and repeat. The technical focus here involves 2 things happening simultaneously: hips moving back and knees staying aligned. You do not need to go low. A small, well-controlled squat is far more beneficial than a deep one performed without stability or confidence. 2 common errors to watch for: shifting the entire body forward into the wall as though falling, and allowing the knees to cave inward. If either occurs, think more deliberately about sending the hips back and ensure the knees are tracking directly in line with the feet. If the movement feels difficult, make it even smaller. A minimal range still counts and still produces results. If you feel comfortable with the motion, you can introduce an isometric hold, pausing in the lowered position for 10 seconds to begin, always free of sharp pain and without any loss of alignment. Dr. Thomas suggests a starting target of 3 to 5 repetitions, progressing toward holds of up to 30 seconds within a range that feels both safe and manageable. What you're working toward is the sensation of your body learning the movement, of being genuinely in control. Muscle effort and a mild burning sensation in the legs are completely normal. Knee pain is not. Exercise 5. The chair key, main exercise. We've now reached the central exercise of this video, and Dr. Thomas intentionally placed it last, because your body is better prepared now than it was at the start. Your thighs are active, your hips are engaged, your glutes are participating. You arrive at this exercise with more capacity and more confidence. Dr. Thomas calls this the chair key because it trains the movement that most clearly defines physical independence: sitting down and standing up with control. Think about real-life situations: rising from the couch, the kitchen chair, the bed, or the bathroom. You perform this movement many times throughout every single day. And when it starts to feel labored, your routine shifts, your confidence drops, and the knee begins making decisions for you. That's why Dr. Thomas places so much importance on this exercise. It builds functional strength within the exact pattern your daily life actually requires. To perform it, use a stable chair, ideally placed against a wall so it won't slide. Sit toward the front of the seat, feet flat on the floor and approximately hip-width apart. Before standing, lean your torso slightly forward, as though your nose is moving toward your knees. This helps redistribute your weight and removes that stuck, heavy feeling at the start of the movement. Now push the floor away with both feet and rise slowly to a fully upright position. There's no need to hurry. Once standing, reset your posture, then lower yourself back down very slowly, controlling every inch of the descent. If possible, make contact with the chair gently rather than dropping into it. That controlled lowering phase is one of the most important components of the exercise because it builds significant strength and protects the knee simultaneously. The central technical principle Dr. Thomas emphasizes throughout this entire video is this: slow descent, plus knee alignment, plus the hips participating in the movement. Don't allow the knee to carry the entire load. Think about sending your hips back as you sit down, exactly as you practiced in the wall squat, and keep the knees tracking in line with the feet throughout. Two frequent mistakes: using momentum to launch upward and dropping into the chair on the way down. The correction is simple: rise at a comfortable but controlled pace, and on the descent, think of it as braking gradually rather than landing. If this feels difficult today, use your hands on your thighs or the chair arms for assistance and reduce the range while maintaining full control. If standing still feels heavy, begin by practicing only the stand-up phase with hand support, combined with the slow, controlled sit-down. That combination alone produces meaningful results. If the exercise feels easy, progress in one of two ways. Gradually reduce hand involvement until you can complete the movement without support, or add a 1 to 2 second pause just before making contact with the chair, as though you're floating briefly above the seat. Dr. Thomas recommends starting with 5 to 8 repetitions for 1 to 2 sets. As you grow more comfortable, build toward 8 to 10 repetitions, always keeping technique as the priority. And remember the agreement made at the start: mild muscle fatigue is expected. Sharp knee pain is not. If sharp pain appears, reduce the range, increase your support, and step back one level. Weekly plan, progress signs, and closing. In the first week, perform this full sequence 3 times per week on alternating days. The focus during this phase is learning the movements correctly and performing everything with genuine control. No rushing and no pushing through pain. In the second week, maintain the same frequency, but introduce a small, deliberate progression. Use less hand support, focus more on controlling the descent, or add a resistance band to the hip exercises if they've started to feel easy. How will you know the routine is working? You'll begin noticing subtle improvements in daily life. Standing up requires noticeably less effort. Stiffness after sitting for a period decreases. Your knee begins to feel more dependable beneath you. These are the right indicators, not dramatic overnight changes, but real, steady progress that Dr. Thomas sees in his patients consistently. Here's a straightforward bonus tip from Dr. Thomas that makes a meaningful difference for many people. Avoid remaining in one position for extended periods. If you're seated for a long stretch, aim to stand up every 45 to 60 minutes and walk for 1 to 2 minutes, even just within your home. This helps mobilize the joint, supports circulation, and reduces the stiffness that causes the knee to protest when you finally rise. It's a small habit, but when combined consistently with the exercises, many people find it significantly improves how their knee feels throughout the day. The exercises Dr. Thomas covered today can already produce real benefit, particularly when you're consistent and honest with your limits. But Dr. Thomas also knows that in practice, many people find it difficult to maintain momentum independently. They start with intention, then become unsure whether they're performing the movements correctly, uncertain how to progress, or they simply lose direction over time. If that resonates with you, Dr. Thomas has left a structured program link in the first pinned comment. It's a more organized option for anyone who wants a complete home routine, one built around real-life movement, no impact, and a clear focus on improving mobility, control, and confidence in the knee. It's not about quick fixes. It's about having a well-defined path to follow with consistency. If this video was useful to you, let Dr. Thomas know in the comments. Which exercise are you planning to start with today? Dr. Thomas genuinely enjoys reading your responses, and they help him understand what content to bring you next. And if you want to continue taking care of your body with simple, safe exercises designed for real life after 60, make sure to like and subscribe. In the next video, Dr. Thomas will show you simple, safe stretches for knee pain to help reduce stiffness, improve movement, and complement this no-impact strengthening plan. See you there.